Welcome to Your City on Community 7 Television. I'm Shoots Veis, and I'm your host. Each month, we look at a different aspect of what's going on with the city of Billings. And in the COVID-19 pandemic times, we've been doing some of our Your City shows from Zoom meetings, and we're going to do that again this month, and we may be doing it again the month after, and we may be doing it again the month after. That's kind of the nature of the pandemic at this point. We're going to roll with it the best we can. This month, we're very excited to have with us Fire Chief Bill Rash. Chief Rash, thank you so much for coming on with us and visiting with us today about what's going on with the fire department.
My pleasure, Shoots.
All right, thanks. Let's take a step back a little bit and let's talk about what kind of pre-pandemic, whatever. What is the role of the fire department for the city of Billings? Why do we have a fire department for the city of Billings, and what's kind of the role of the fire department for the city?
Actually, a lot of reasons. When I started in the business as a firefighter in 1978, it was basically put the wet stuff and the red stuff. It was a kind of a one-dimensional service, if you will. Through the years, the last 40-some years, it's developed into what it is today and how we service the city of Billings and the Billings Urban Fire Service Area, which surrounds contract area and the county surrounds the city. We are now a multi-discipline organization that provides not only fire suppression, again, grass, any on fire, we take care of that, hazardous materials, to include biohazards, you name the hazard. We've got a regional team, excellent team here, rope rescues, our car extrication, which, anymore seems like that we're running several of those per day. We have a multitude of disciplines that we deal with, water rescue, all the things that we seem to have found in the past. EMS obviously is a big one, emergency medical services, that whenever there was a need that nobody was providing, then through the years, the fire department, Billings being one of the leaders, has evolved to be able to fill those roles to better service our citizens.
All right. So, given that, kind of your role is to help out there when there's an emergency out there. And again, taking a step back from where we are today, how do you plan with some of those other agencies within Yellowstone County, the city of Billings, who are also tasked with that, hospitals and sheriff's departments and police departments? And how do you kind of do that sort of planning outside of being in the middle of a pandemic?
Okay, I'll step back too, if I could, Shoes. Basically, I want to make sure and make sure everybody is aware that the 911 center is under the umbrella of the fire department. And we never want to leave our 911 dispatchers out of the picture, because that's where the heartbeat is, that's where it begins, that's where it ends. So I'll be referencing them quite often during this.
Yeah.
Prior to that, what we have, obviously the Local Emergency Planning Committee, the LEPC, is an extremely active organization that brings all of our partners together, both public and private sector. And that's a wonderful organization. Joe Markoff from Billings Clinic has been chair of that for as long as I've been in this county. So what we do is there's a lot of exercises there with tabletops, other opportunities that each partner puts on for training, those type of things, coordination, grants. Outside of that core of the LEPC, we also train and work very effectively with our mutual aid partners throughout other fire services throughout Yellowstone County, as well as we work very well with the Yellowstone County Sheriff's Office and the Billings Police Department. We do train with the Billings Police Department because we are part of what we call a rescue task force, and that's an active shooter program that where the firefighters, we actually have Kevlar helmets, Kevlar vests, and the things that we can go in and more effectively through lessons learned in other areas on how we can work closer together to be more effective and take care of those kind of situations.
All right. And now let's talk more specifically about COVID-19 and the pandemic. When did you guys get involved with the planning? What kind of planning was done? And then kind of what is the role of the fire department through the course of this pandemic? What has been the role that you guys have been tasked with?
I would say roughly March 1st, when this started becoming an issue, is when we began, I'll say, planning more specifically to COVID-19. Our partners at American Medical Response and all of the folks that I mentioned earlier, we always plan for a lot of different things. Sometimes they, as you know, they morph into something a little different than what we were actually planning for. But the basic core of the incident command system, things like that, the unified command, the UHC, unified health command, all those kind of things are always there. They're set up. So we just have to adapt to the situation at hand. So we have basically, the folks of the fire department through this is just been basically being much more aware of how we're approaching our patients. We have worked very hard with American Medical Response. We've developed strategies so that when we know that there's a potential, and this starts back to our 911 center, they triage or screen the calls coming in to determine if there's anything that would be an indicator that this could be, like, for example, COVID-19 or symptomatic of such. Then that we take even extra precautions down to, as with AMR, down to our masks, full face masks, gowns, whatever it has to take. So that's been one thing we've done is starts there, go into a situation, have limited contact with folks that may be candidates for COVID-19. And we just try to, even if it takes one person to go in there and put a mask on that individual, and then start asking questions and then go with treatment from there. So specifically, that's how our operations have changed with emergency medical responses, but that goes even broader too, Shoots, in terms of every incident that we respond to, you have that potential. And our big change that we have had is with the Billings Fire Department has been paramount and remains paramount that we protect our firefighters and EMS providers. Because if we start going through our ranks with an infection, a virus infection, we will be out of people and our ability to serve the public very quickly.
Sure. What kind of plannings and steps did you have to take? Because yes, we're in the middle of a pandemic, and yes, everyone's aware of that. But there's still all those things that the fire department is here for, and those things probably didn't just stop because we're in the middle of a pandemic. What steps did you have to do specifically to, kind of protect those firefighters, make sure they're not going out? What kind of equipment did they have to have? Any changes in procedures you guys had to do when you're responding to, what was a normal fire department role? Now we're in the middle of a pandemic, and yeah, we still have to have that same fire department role, but we can't probably respond the way that we did before.
Certainly. Again, what we did primarily is we needed to assess the information that came out as it came out, because, like we all know, this has evolved. We didn't have any clue really what we were dealing with initially. And within the fire department, we took our EMS coordinator, Brian Francis, one of our battalion chiefs who's had a lot of preparedness training on the national level, Jason Lyon, and we actually put them into full-time roles, if you will, of just monitoring, learning, assessing CDC, various websites to determine what's the best way to protect our people, realizing how valuable 911 and our firefighters are to the community. So we did take different practices. We had morning briefings, which we always conduct, but now most of that meeting, until people were called up, they got the information later. We would put out an actual, we'd share on the screens, all of the things that we need to remind ourselves to do, to questions asked, preparedness, making sure our personal protective equipment, PPE, that was on properly, that we were properly equipped, and walking into this with a good mind frame. A big thing, again, on the prevention side is we began logging when people would come to work, our firefighters, all of our personnel, 911 dispatchers, when we come through the door on shift, we would take temperatures, answer questions. Until just recently, we firefighters did that 3 times during a 24-hour shift, beginning of shift, mid-shift, after shift. If there's any question about it, any potential symptoms or over 100.4 degrees, we would go down another route that we'd already prepared to the fire department, thanks to our many talented people here and working with occupational health to refer them to them. That continues to this day. So we know ahead of time, we know at the end of shifts where we're at, so we can help monitor our firefighter safety.
Sure. I'm a little bit curious about this. We talked about the fact that, just because we're in the middle of a pandemic doesn't mean the role of the fire department for the other things you're there for, that goes away. Overall, I guess I don't need numbers or statistics, but anecdotally from you, has this been a time that's been more busy for the fire department, or maybe because people are sheltering in place and not out as much, less busy on the routine kind of calls that you guys are going out for?
Um, Initially, we did see a reduction in calls, as people sheltered in place, and there was I don't want to say fear, but there was apprehension, concern of the unknown, and our calls definitely went down. Um, we were expecting and had been planning and talking in on a daily basis with all of our shifts that as we move forward and whenever the reopening begins, we'll probably see a spike. So it did slow down, but then even prior to the governor's directive adjustments in the last week or two, we started to see a spike upward.
Mm.
And in the last 2 weeks, we have had been well above average on our calls. But interestingly enough, they have not the increase in calls has not been related to COVID-19.
Mm.
It's people getting out, warmer weather, but definitely we a larger increase of calls than what we normally see in this time of year.
All right. Walk us through kind of what a typical week has looked like for you as the fire chief over the last couple of months. Where do you need to be? What meetings do you need to be in? What meetings do you need to be in with the city of Billings? What meetings do you need to be in with Unified Health Command? What meetings do you need to be in with your employees? Walk us through what those last couple of weeks have kind of looked like for you.
They've been challenging, but things have somewhat leveled out in terms of our ability collectively throughout the community, and all the responders and government agencies to be able to kind of get everything put together and get into a routine, if you will, kind of get into the groove. So basically, what we did is we start off every morning with an awareness issue with our personnel. That's a big thing. We have been involved, our personnel within our department, with the Unified Incident Command, which is put together with the County DES, Casey Williams, and the Board of County Commissioners. So we have been working with them in various capacities, taking their guidance. When we have personal protective equipment needs, requests, other things, we go to the UIC, Unified Incident Command. We go to them with the requests with that, so that we have or an organizational thing, incident command wise. On the city side, been very proactive. There's definitely been an increase in meetings right from the beginning, because we want to make sure that our policymakers have been involved, and they have been kept apprised by City Administrator Chris Kukulski, and then he has had meetings with us a couple times a week, or if not more, individually or otherwise, just to make sure that we're all on the same page. We're out there trying to apply for grants. We're tracking our hours. We're doing whatever we can do, not only on the emergency response side, but as well as recovery, because this obviously is impacting the city with overtime and various materials and things too.
Sure. Talk to us a little bit. I think one of the things that everybody is most proud of and was the ability of the library to kind of become a childcare center for essential workers. How important was that to the fire department? Do you have a lot of employees that are taking advantage of that being open during this pandemic?
Number one, I'd like to say, accolades to Gavin Wolter, our library director. He has been also EIO. He's been double hatting it, so to speak. He has done an awesome job in helping to coordinate that and helping to coordinate so many things that we are so thankful for. We have had not a lot of our firefighters. I really couldn't give you a percentage, but we have had firefighters and other first responders use that, and they've needed to. It's been very important, so they can come to work. But like with what we always find with in almost any case, our first responders, firefighters, police, 911 director, operators, they rise to the call when the time is, when they really say, "Hey, I need to be home with my kids." They get to work. They find other ways to take care of that, because they realize how important this job is, and the effect that it actually has in our community. I honestly, I got to throw this in there. I couldn't be more proud of our firefighters and our 911 directors or direct operators. They're doing an awesome job.
Yeah. Talk to us a little bit about the 911 center. I know you talked about, when we first started, as a fire department, maybe it was a little slow and it's picked right back up again. I'm assuming for those guys, it's never slowed down and it's only picked up.
Rarely slow over there. I mean, you might get a little bit of a lull, but normally when they're not dealing with absolute emergency calls, they're dealing with informational calls that come across to 911. What about this? How do I handle that? They do a great job, and especially during this time when COVID-19, they do have, again, their responsibilities have further increased because they're doing more scrutiny of calls to
Mm,
determine if there's a need to have a different response, to make sure our responders, all
right.
of the responders, are as aware as possible of what they may be walking into. They
Sure.
always have done a great job, and particularly here, so that we are knowing that COVID-19 is a big deal, and they want to make sure that everybody is taking every precaution. So yeah, there's no lull over there. They stay busy. They rise to the challenge, and we have a great crew over there, and we're still recruiting, so we'd like to have some more.
Yeah, absolutely. Did you notice? I know that it's a pretty new 911 center over there, and built in with that was some things to take advantage of. Not necessarily a situation like this, but some situations that aren't usual. Were they able to utilize some of the functions that were built into that new 911 center during the course of the pandemic, just because of the, I guess, strange nature of what's going on out there?
Well, I would say a couple things. Yes, I would say number one, um, I wish I had a screen and had a photo I could share with the viewers. But number one, if you ever looked at our old bunker, so to speak, that we had, I mean, you were lucky to cram 10 people in there. And you want to talk about social
Yeah,
distancing? It
yeah,
wasn't happening.
yeah.
This is a much better opportunity for social
Yeah.
distancing in the new center. So that was a huge deal. Along with that, there's been a lot of extra hours that our 911 dispatchers have had to put in, longer hours. That new facility gives us an actual kitchen and an area that really helped them to be able to rehabilitate, if you will, and take a break and come back. And those folks out there, to be honest with you, it's not unusual for them to work 16-hour shifts due to staff shortages, things like that. So there's a lot of the things that were built into that are being used, like things like that, being able to social distance, multiple phone lines. I mean, just things that have really helped, I think, their operation during this time.
All right, very good. Have you been able to reach out to other fire chiefs across Montana or across the nation, do some networking? Here's what's working here, here's what's not working. Did you try this? Did you try that? Have you been able to reach out and have those discussions across Montana or across the country?
Absolutely, we've done both throughout the nation. We have certain professional contacts throughout the nation. The International Association of Fire Chiefs has been a good resource. The International Association of Firefighters has an awesome website we've gotten information from. My brother's an assistant chief in Spokane County, Washington. So when
Yeah.
this started, I was pretty much on the phone with him. It wasn't necessarily for social reasons. Gleaning information because he was experiencing some of these things coming from Seattle and this way. So we have done that throughout the nation as well as within the state. We've traded ideas, thoughts, how we're operating, how we're interfacing with our hospitals, healthcare facilities. So especially up front, we were talking a lot to try to see what we were doing, and really as usual when you network, get a lot of really good ideas, and we were able to provide some good ideas with a lot of the talented folks we have here in Yellowstone County.
Sure. Could you give us a flavor of maybe one or two of those things that you were able to talk to them about and say, "Man, that's a good idea. We're going to go ahead and implement that here as part of our response."
Well, I think one of the big things was that we picked up early on from outside was when, because of the lack of personal protective equipment, PPE, that we were very concerned because when we started trying to gather more as this unfolded, it wasn't enough. So our folks here were working on contingencies. So we had 2 or 3 levels of depth, which we were very thankful. Our folks here at the fire department, they were able to get that handled. But from Washington, for example, being able to take that mask, send one person in masked up, take the mask in to the patient, put the mask on the patient so that we
Mm,
would be able to limit the exposure to them. And then that help conserve our
sure.
PPE. So that was one of the big takeaways from this, as well as just how do we transport. I think the constant communication is what are we doing differently? We found out at the end of the day, to date, I'll say that really everybody's pretty much been on the same page throughout the nation.
All right, good deal. I know when we think of the fire department, we certainly think of the firemen that are out there. We probably also think of the 911 operators, but there's other folks that work at the fire department. Do you have any personnel that are considered non-essential, and were they able to telework? Did they still come to work? Talk to us about maybe some of those personnel that maybe don't come to mind when we think of the big red truck screaming down the road.
That's a great point, Shoots. Yes, we have people that they are all essential because we still have a federal mandate, for example, as to be able to provide, to go through, proofread, if you will, scrutinize, and report to the federal system, fire reports, EMS, things like this. So we were able to, we have 4 administrative support workers for police and for fire and 911. So 2 of those we were able to send home to telework, and they were able to do that and still are doing it until June 1st, effectively. Those are the folks that still have, public records requests that come through. The Fire Prevention Bureau has investigative reports and a lot of things that just really, because you're right, because this happens, that business doesn't stop. It still has to be done. So we were able to put 2 people at home doing that. We were able to keep 2 on staff and working. We have the social distancing, alternating some days, but keeping them here in the fire station too, because we still get phone calls. We still have things we have to answer and take care of here, timesheets, bills, all those kind of things. So we really kind of call everybody essential to the operation and the mission of firefighters and 911.
Sure. All right. As things have, I think we've been very blessed here in Montana that we have had some cases and whatever, but it's been better than certainly a lot of other places. And we're starting to see things open back up again. What sort of planning are you guys doing as the fire department and with the Unified Health Command as we open back up again? What kind of things are you planning for, looking for, or making your personnel aware of as things kind of slowly get back towards normal?
Well, I know that the Unified Incident Command is still meeting on Mondays and talking and communicating. Again, the system is there, very dedicated people. I think right now what we're really at is as things start to reopen, is keeping that level of awareness up. That's what we're trying to convey to our folks all the time. Plan-wise, it's we've been expecting, based on studies and information we've received, that there should anticipate a spike.
Mm-hmm.
Since the first part of the opening, we haven't seen such a spike yet, but actually not losing that, not becoming complacent is kind of the word of the hour. Is we need to not be complacent. We need to take this seriously. Consider that this may spike, may have a second wave. It may be, flatten out and plateau, but that's pretty much right now is just the lull of and thinking and planning and looking. Quite honestly, not to probably not a good thing to say, but also planning for what if. That's our job too, and that's what the Unified Incident Command LEPC does. Is okay. We're doing okay right now, and you're right. We're blessed to be in Montana. But should this spike or that second wave they keep talking about, we're already throughout the community working together to say, okay, how do we begin stocking, planning, preparing so that we are better prepared and lessons learned this go around. Heaven forbid it ever happen, but if it does, we have never lost sight of we've got to be planning for the future to protect our community.
Yeah. How are you guys doing on stockpiles of your personal protective equipment or any of the other things that you guys have found essential? Is it kind of back to where you wanted to be, or you're going to continue to kind of build that up in case we do hit that what if scenario where we're back in a not so good place?
Well, we're still depending on how this, if a spike were to occur, we could be challenged, within a couple of weeks. So we're not really where we'd like to be, but as time goes on, we are finding more supplies that are becoming more available for personal protective equipment. And as that becomes more available, we are very carefully, because it's a budgetary issue and we're still, again, tracking for reimbursement. But we are looking at that, and we are trying to provide an adequate stockpile for us. It is loosening up. We are getting a little more responsiveness from vendors. It's working itself through, but We can't become complacent. We just can't say, okay, I think we're good, and that's the big deal.
Yeah. This is kind of a down question, but I promise you we'll next head up on more of an up question after that. But what have been some of the most difficult or most trying moments for you in the fire department over the last couple of months?
I think the big challenge for all of us, and particularly our frontline firefighters and our 911 folks, because of the proximity of work and the importance there is the apprehension of, when I go on these things, am I going to get something? Am I going to take it home? We do the best we can, like I had mentioned before, in trying to monitor, do that, have things set up with the city that we've done to support that, to support the prevention and then the treatment. But I think that's probably been the biggest challenge that our personnel has had is when I'm off shift and what am I going to take home to my wife and children, for example? And we've tried very hard to work with that, and our folks have just again, they haven't missed a beat. A scary situation, but they haven't missed a beat. They are careful. They self monitor. They know the importance of it. They're well informed. That's got to be. I don't want to say that's the super downer, but that's the big thing. That, along with the big word of unknown, we had no idea where we were headed with this. We didn't know how it would impact our organization, and scary enough, we didn't know how it would impact the community if we had an infection within the department. I mean, it's the largest department in Montana, but even that, with that being said, it wouldn't take very long with 7 stations to decimate the fire department, and that was still is a huge concern.
Sure. Okay, let's bounce back from that. What has been the best moments of the last couple of months working with the fire department?
Well, I'll say number one, community-wide, is the response from our governments, city, county governments, our hospitals, all of our partners I mentioned before, AMR, the willingness to work together for the common cause. And honestly, not to sound cliche, but for the common good of our community, they have all come together to do a wonderful job. And I just, the bright spot for me is I couldn't be prouder of our staff at the Billings Fire Department, with what resources we have and our 911 center, and being able to come together and say, well, this is what we've got to do. This is our duty. Follow the protocols, be aware, and still go out there and serve the community in the manner that they do. Because believe me, in something like this, as being unprecedented, you just wonder, okay, are people just not going to come to work sometimes?
Mm-hmm.
Because it's like, I'm not going to jeopardize my family. That didn't happen.
Yeah.
These folks are dedicated. I'm very proud of them, and I think that was probably the highlight so far that I've seen. They've just been awesome.
All right. Well, Chief Rash, we thank you so much for joining us today. And on behalf of everyone out there, we want to say thank you to you and your fire department, and appreciate all of the hard work, effort, and the bravery it takes to be out there every day. I know it is a scary situation out there. So thank you guys so much for all you do for the city of Billings. We all do appreciate it.
Thank you, Shoots, and thanks for inviting me here.
You bet.